hospital, which was wholly appropriate, since on its closure an appropriate alternative service was readily available and patients were transferred to a new unit at St Vincent's Hospital in Fairview. But I must put it to the Mental Health Commission that the order to close services in Wexford, while ignoring the consequences of those actions, the Mental Health Commission have lost any moral authority or credibility in respect of protecting the interests of all people who use mental health services. The Mental Health Commission function, I would respectfully suggest, is to protect, not destroy, and in this regard I believe it is time to examine whether the Commission represents value for money. According to the Mental Health Commission annual report for 2009, its non-capital allocation for 2009 was over 19 million. We also wrote to the Vision for Change Independent Monitoring Group requesting a meeting to outline to them the appalling disregard for the principles and recommendations in Vision for Change arising from the Wexford-Waterford reconfiguration plan, and their response was equally disappointing. They state that the group is of the view that a meeting to discuss the local reconfiguration of services is not appropriate for the Independent Monitoring Group. We then wrote to the Office of the Assistant National Director for Mental Health, setting out very comprehensively that on the closure of the acute admission beds, that the community developments as outlined in Vision for Change as being essential were not in place. Not alone did we detail these, but we outlined the solutions that could be implemented immediately and within budget, since 2 wards were closing, which would free up significant resources to develop the alternatives. We formally requested that his office would arrange for an independent assessment of the non-compliance with the provisions of Vision for Change. His response was even more disappointing, because not only did he not accede to this request for an independent review, but he attempted to justify what was happening. A sample of responses to some of the issues were as follows. Home-based care teams will become available as soon as resources permit, and that resources released by ward closures only become fully available when the needs of all inpatients have been addressed, which is a major departure from what has been government policy up to now, that resources freed up as a result of ward closures would be fully utilised to develop the community in accordance with Vision for Change, a commitment you yourself, Minister, have endorsed. What is happening now is that resources freed up are being used to cut costs and to prop up existing wards in the institution, which means that there is no community development. If this is the new policy, then is it any wonder that the Mental Health Commission found regression in the way services were provided and a reversion to a more custodial form of mental health care? When responsible professionals like ourselves, and indeed the GP and consultant psychiatrist group who wrote to the HSE, expressed serious concerns about what the dictatorial management of HSE South are doing to the services in Wexford, and when we raised these concerns formally with those that we thought had responsibility for ensuring standards, and when those bodies either don't want to know or are unable or unwilling to become involved, then we have no place or no one to turn to within mental health. The P&A are hugely concerned now about the ability of services in Wexford to respond. This county, more than any other, needs a comprehensive mental health service, considering its history of appalling tragedies. We had no choice but to cooperate with the closure of the 2 acute units because of the Mental Health Commission order, but we do not agree with it and continue to be totally opposed to it. This was the reason why this was a very hot election issue in Wexford and why the P&A campaigned tirelessly to have these decisions overturned. The leader of the Labour Party, and now Taoiseach Mr Gilmore, gave a public commitment that were the Labour Party to be in government, his party would reverse the decision and would provide acute psychiatric beds at Wexford General Hospital. I understand that you yourself, Minister, ordered that there be no further withdrawal of services from local hospitals until you review the proposed changes as to how services are reorganised, and that you issued this instruction to the Secretary-General of the Department of Health and the HSE on the 16th of March. And I understand that this instruction covers all areas of health, including the psychiatric services. I welcome that, and I am calling on you to commence this review in the Wexford, Waterford and South Tipperary areas as a matter of priority. Vision for Change has now been used for what we always suspected it would be used for. It has become a further money-saving opportunity, just like its predecessor, Planning for the Future. Our services are being dismantled and destroyed in the name of Vision for Change. Mr Colm O'Gorman, Executive Director of Amnesty International Ireland, recently stated that the bottom line is that despite Vision for Change providing a clear programme of reform for mental health services, this programme is not being pursued. He goes on to state that reports that have issued during last summer from the Mental Health Commission, the Independent Monitoring Group and the PNA not only point to serious human rights concerns, but also reveal that the lives of people in Ireland are being unfairly and unjustly compromised, and we can't pretend we don't know this is happening. He called on the government for an immediate commitment to prioritise mental health. Earlier this year, the Irish College of Psychiatrists produced a report entitled Excluded, Expelled and Exported, a report on the 5th anniversary of Vision for Change relating to mental health needs of people with intellectual disabilities. The report focuses on the gross inadequacies that exist for one of the most vulnerable groups in our society. It refers to the Vision for Change recommendation that there should be 39 mental health intellectual disability teams nationally, and that 5 years on only 2 exist in Dublin, and even those are not staffed appropriately. When the PNA raised the necessity for 3 such teams in the Wexford-Waterford catchment area based on their population, we were given a blunt refusal. The College of Psychiatry report also noted that 55 Irish citizens with an intellectual disability are currently being cared for in specialist services outside the state at considerable human and financial cost because of the absence of appropriate residential services here. The report stated that even if exporting Irish citizens with intellectual disability and challenging behaviour were a rational and humane way of providing a service to them and their families, it would not be sustainable. According to figures obtained by the College under Freedom of Information, the annual cost of placement for 20 individuals is under 50,000 each. A further 20 individuals cost between 50 and 100,000 a year, while the cost in 6 cases is between 100 and 200,000. 7 cases cost between 2 and 300,000, and 1 case is costing more than 300,000 per year. The PNA believes that if the recommendations as outlined in Vision for Change were implemented, it would substantially cut down the numbers having to go outside the state to receive care, would save the state money, and would mean that those highly committed and motivated, newly qualified psychiatric and intellectual disability nurses could be employed at home. In respect of child and adolescent services, it has to be acknowledged that some progress is being made, particularly with the provision of acute inpatient beds, but in reality it only brings the number of beds to just over 50, which is back up to the number that we had 10 years ago. It remains a scandal that according to the HSE's own figures, there are still 2,800 young people on waiting lists for access to services, with 500 waiting for more than 1 year, 600 waiting between 6 months and 1 year, and 615 waiting between 3 months and 6 months. The PNA have been campaigning for years for more resources for child and adolescent psychiatry, because if the child or adolescent is treated appropriately and in time, it may prevent a lifetime of reliance on the adult mental health service. Before I move away from the Wexford-Waterford reconfiguration plan, may I refer to the Labour Court recommendation 19988. Delegates may recall that the management team drew up a plan unilaterally and deliberately excluded the unions from any involvement in this preparation, and then presented that plan for implementation with the clear expectation that the unions would give their total cooperation. The management position being that they only had to consult with the staff in respect of implementation. The PNA challenged this as being wrong and contrary to numerous agreements and the law, including the current Public Service Agreement and the HSE's own policy document, HSEA User's Guide to Managing Change in the HSE, and the HSE Information and Consultation Agreement, which gives effect to the EU Directive, and the 206 Act. But the HSE South were having none of it, and we referred the matter to the Labour Court. The Labour Court in the recommendation stated inter alia that the transformation programme requires that all parties continue to engage meaningfully with each other on both the drafting and the implementation of all aspects of proposed plans. The Court went on to state that both management and unions should recognise that the requirement to consult is contained in the agreement to facilitate change and not delay or frustrate it, but that equally the consultation must be meaningful and genuine and not simply an empty procedural technicality to comply with the provisions of the agreement. This is a landmark finding that gives the trade unions an absolute right to participate in the drafting stage when changes are being contemplated by management. Mr. P.J. Fitzpatrick, Chairman of the National Implementation Body of the Public Service Agreement, speaking at a Tagus conference, stressed the importance of the Court's St. Sinan's decision, and consultation in the whole public sector. Delegates, we have a new government, a new Minister for Health, Dr. James Riley, TD, a new Minister with responsibility for mental health, Ms. Kathleen Lynch, TD, and a new Minister for Primary Care, Ms. Roisin Shortall, TD. Congratulations to all, and may I take this opportunity to wish the Government, and particularly the three new Ministers, every success in the daunting task ahead. Your success will have a direct impact on our members, both as providers and consumers of the health service, and more particularly on the vulnerable patients that we directly care for. Both parties now in government, prior to the election, spoke inter alia about how the creation of the HSE has been a disaster, about how the HSE is too big, does not answer to democratic control, does not know how our healthcare budget is being spent, and has cut hospital care while increasing layer after layer of highly paid bureaucracy. About the last Minister for Health being invisible, hiding behind the HSE, about how the government has cut public hospital and community services, about how waiting lists are climbing, and about the two-tier system of care continuing. It is hard to disagree with any of this. Their policies spoke about the necessity for the Minister for Health to be clearly in charge of the health service and answerable to the government and Dáil Éireann. The P&A welcomes this, and it is our hope that this has already happened. The programme for government states that it will bring about a universal single-tier health service which guarantees access to medical care based on need, not income, and that this will be paid for through a universal health insurance. On mental health, the government programme states that our policy incorporates the recommendations of a vision for change and are committed to reducing the stigma of mental illness, ensuring early and appropriate intervention, and vastly improving access to modern mental health service in the community, and goes on to state that a comprehensive range of mental health services will be included as part of the standard insurance package offered under universal health insurance. Given the central role of primary care in our reforms, government will ensure that patients can access mental health services in the primary care setting. The government will ring-fence 35 million annually from within the health budget to develop community mental health teams and services as outlined in a vision for change to ensure early access to more appropriate services for adults and children and improve integration with primary care services. They will close unsuitable psychiatric institutions, moving patients to more appropriate community-based facilities. We are absolutely delighted with the commitment from the new government that patients can access mental health services in the primary care setting, and that a new minister has specific responsibility for primary care, because the HSE's commitment to mental health primary care services is abysmal. This has been a continuous bugbear of this union over a number of years. The previous government's failure to recognise the value of incorporating the RPN within the primary care team. Despite the success of pilot projects in West Cork and Cashel and Ballymun, there has been resistance to the mainstreaming of primary care psychiatric nursing services. Again, Vision for Change asserts as one of its key recommendations the enhancement and formalisation of links between specialist mental health services and primary care. This proposed strengthening of the relationship is consistent with the World Health Organization report, New Mental Health, New Understanding and New Hope, which endorses the provision of treatment within primary care services. Our Research and Development Advisor, Aisling Culhane, is preparing a position paper on this and other relevant matters, and I am to request a meeting with your Minister to present this paper. I welcome the new government commitment to ring-fence 35 million annually from the health budget, mainly to develop community mental health teams, but I must dwell for a moment on mental health budgets. As I mentioned earlier, the Inspector of Mental Health Services described the funding of the mental health services as opaque and almost incomprehensible. I believe that there is in reality no mental health budget, and spending on mental health is determined at the year end when the scraps that fall from the table of the health budget are swept together to establish a mental health spending and are reducing all the time. We and many others who advocate for better mental health services have become very cynical when it comes to promises from government about additional funding or ring-fencing of funding, because the last government failed to honour almost all its commitments. When Vision for Change was endorsed by the government in 2006, it was detailed in the report that in order to implement its recommendations, it would require an additional 21.6 million every year for 7 years, for an additional 150 million of new money that was on top of the 800 million then being spent on mental health services. Some new money was put in, 26.2 million in 2006, and 1.2 million of this was for suicide prevention, and 25 million in 07